Hi, I hope everybody is doing okay. This video is the feeding to get checked off on it. When you start, make sure you would always want to look at the doctor's orders to make sure that they can eat and they have the right kind of diet. Always wash your hands. You can foam on this video, or you can wash your hands in the sink. Don your gloves. Now, depending on your patient and how much they can move, you might have to do a couple things. A lot of hospitals now are putting the hand sanitizers, a little bottle at the bedside, and they can wash their hands. And if you had a lot of mobility, then you would just need to set up the tray maybe, or just drop off the tray and go from there. But we're going to pretend like he needs more assistance than that. Also, if they're elderly and maybe they've been picking at different things, their IV or a wound, or just, look at their hands. Sometimes you might have to take a wipe. And the hospitals are really good at having these at the bedside too, and remove any debris that you might see. Sometimes the hand sanitizer isn't working enough in cleaning those fingernails. You might need to wipe the mouth. Okay. All right. So again, before you start feeding your patient, make sure they have the right diet. I have actually in the past made a mistake, had diabetics, and put their tray, or somebody has put their tray in the room, and it was a regular tray. And of course, they eat everything on there in the dessert, and you go and check their blood sugar, and it's extremely high. And they don't tell you at the time that they've had a tray that wasn't suited for them. They're gonna eat that cake or pudding or whatnot. So make sure that they get the right tray, so they're getting that if they're diabetic or need low residue or no salt. And once you get the tray, you can put it in there. And again, it just depends on your patient, and as you take care of them, you learn what their abilities are. Sometimes if they have arthritis, you might just need to open everything up for them and get everything situated, and they can feed themselves. But sometimes just the small plastic items are hard to open, and then some that you're going to might just sit in there and feed them. Okay. When you're giving your patient hot food, make sure that it's appropriate and it's not going to burn them. Make sure it's cooled off, and I actually had to let this cool off for a while. I'm cutting it up. When you're feeding your patient, you want to hold the utensil at the right angle. You can't come in like this or like this. You want to come at the right angle. You're going to put the food at the tip of the spoon or the fork. It's very important that you give them time to chew. And one of the biggest things that you're going to look for are swallowing problems. If they have any swallowing problems, you need to stop and let the nurse know. Or if you're the nurse, you need to let the doctor know. And they might need to change the diet to a soft or a puree. They'll also get OT in to evaluate the swallowing. But that's really a really big item to make sure that they are able to swallow. Also, if they're very nauseated, you might have to start with a different diet. Say they got regular food, and you might have to start with a clear diet and work their way back up. Again, watch your angle. Food at the tip of the utensil. Also, you want to alternate between your food. And of course, they're going to have multiple things on there. If they have problems seeing, tell them what's on the plate. I don't know if you've ever given somebody a beverage, but you need to use a straw. It is really hard to give somebody a drink without a straw, because it's going to go all over them. You want to encourage your food, especially encourage them to eat their food, especially if they're not getting very much protein in, if they've been sick for a while. People can't heal unless they're getting the appropriate amount of nutrients in. So sometimes patients need to be encouraged to eat, like saying things like, well, let's just try a couple more bites. And it's really important that they order their food, or the family orders their food, or you order the food so they're getting foods that they like. All right, we'll do another drink here. He's got one more of these raviolis in, and we'll give that to him. Isn't he a great little patient? This is my husband, Paul, y'all. So after you fed your patient, and you can feed your patient pudding, applesauce, granola bar. I like it to be something sort of healthy, or if you want to do a whole meal, that's fine too. And again, you want to alternate between the food and the drink. Now, if your patient has spilled on themselves, you need to help them with a new gown, or maybe you've come back to pick up the tray. You need to make sure there's not food all over their face, so you wipe up their face and hands, or put a new gown on them. Because you want to keep your patient clean, so you might have to do a little bit of hygiene on them. When you're all done, you're going to clean your area up. You're going to tell your patient when you're going to come back, and Mr. Henson, I'm going to come back in about 30-40 minutes, check on you. I need to go do some charting. On your lab sheet, I want you to chart and bring that in the next time we have class. And remember, it's date, military time, and you're going to chart what you did, what you saw, and how the patient handled it. Make sure, so I started with 10 fluid ounces of water, and he drank 3 ounces of it. So keep track. If you're doing it by cups, 1 cup is 8 ounce, or half a cup is 4 ounce. I don't care if you put it in cups or ounces, and you're gonna find, depending on where you work, what they want. Also, this is a cup of ravioli, so I'm going to put 1 serving, and I'm even going to put a slash 1 cup of ravioli. Patient ate all of his ravioli, 1 cup, and drank 3 ounces of water. Okay? If you have any questions or concerns, please email me or text me. And make sure, y'all make sure and take your gloves off appropriately. It's still on our last checkup. I saw a couple people wanting to come up here at the wrist. It is hole in the middle. Come in and put it in the wastebasket. And foam or wash your hands. Okay, thank you.